All right, we'll go ahead and get started here. If you could initiate that recording, and I'll just give everybody a nice welcome. We may have some last minute folks walk in, and that's okay. We'll just kind of get us started nice and slow. I want to let everybody know this is an open forum meeting. So ask questions as they come up. If you're joining us online, you can text a question into that chat feature, and we'll answer that live here. We are specifically going to be going over the plan changes and updates to the United HealthCare AARP Medicare Complete Choice 1 PPO plan. Now, United HealthCare has several plans with different networks, so if you're not sure which plan you're on, please pull out your ID card and you can verify the plan name on the card. I believe it's in the bottom right-hand corner. I'm going off memory here, but it should list that information. Now, before we get started, I want to point out some resources that we have here in person. We'll send them out digitally for those who are joining us online. There's a flyer that says Medicare and all that jazz. That has some great tips and tricks for you. So one thing that we're happy to announce is the 2023 Medicare Part B premium that comes out of your Social Security check automatically is reduced to $164.90. If you're not drawing Social Security, it'll come on a direct bill. Did you get a copy of that one, Ruth? The Medicare and all that jazz? Perfect. We're waiting to get the Social Security cost of living adjustment. It is expected to be an increase, but we don't quite know what that's going to look like. So we're happy that you're going to get some savings, about $64 a year in savings, and then whatever that cost of living adjustment will be. So very excited for that. Couple other of big items I want to address that are common questions. Our office receives. Medicare does not make outbound phone calls. If you get a call from somebody who says they're calling from Medicare, it is likely a solicitation. It is very rare that they will call ever. So be very careful when you're talking to those folks on the phone. We've had several clients accidentally get signed up for a plan and disenrolled from their current coverage because they thought they were just asking for information, but turns out it was interpreted as, yes, I want to join up on your plan. So be very mindful. Also, want to address the multitude of commercials you are receiving from Captain Kirk and JJ Walker. A lot of those plans are for other states. They're not even specific to Idaho. So if you're getting hooked on this, we're going to put money back in your Social Security check, we're going to give you pest control, we're going to pay for your groceries. We don't have that here in Idaho. We could talk about those benefits if you want to get more information. There are plans that do give you money back on your Social Security, but guess what? You usually have to give up your drug coverage to get that. Guess Captain Kirk forgot to mention that in his commercial, didn't he? Yeah. So please be careful. Remember, the biggest priority is making sure your medical needs are met before we pick the extras like dental and vision and the over-the-counter benefits. Those are gravy on top, but let's make sure your doctors are covered, your meds are covered, and that we're addressing what your needs are. Okay, so that's some little housekeeping. Let's go ahead and get started on the benefits for this plan. Very happy to announce that there is no change in the monthly premium. It is going to be $19 a month. Remember, everybody pays their Medicare Part B premium. That is standard. But this plan has an additional $19 monthly cost for the membership. So essentially, that's going to cover your medical and prescription coverage. So the max out of pocket, that is going to go down on the out-of-network. It'll stay the same for in-network. It's $4,700. Out-of-network will reduce to $8,500. So that gives you a little bit of savings there. Remember, the importance of a max out-of-pocket is this is your stop loss for the year, the most that you will spend in medical costs for inpatient and outpatient services. The medications you receive in the hospital and that are administered by a medical professional will count towards this max out of pocket, but not the prescriptions you fill at the pharmacy. That is a separate bucket. It's called the donut hole. And again, we have some resources about that out on the table. We will send those digitally to those attending virtually. Very important that you know you have access to out-of-network coverage. You will save more when you stay in-network, but you have the choice and the power of a PPO plan to go out-of-network. You will spend a little bit more, but again, if it's a doctor you really, really want, then you have the coverage for that. So we like those extras that are built into this plan. Very important that you establish good primary care. You want a primary care physician that you feel comfortable with to help manage your everyday medications, that you can do follow-ups with on your everyday needs. You're going to save a lot of money by working with a primary care doctor. It's a $0 copay to see a primary care physician. And it's a lot quicker to get into their office, especially now with how many people are moving to Idaho. The wait to get into a specialist is sometimes more than 8 weeks. So keep that in mind. Get a good relationship with a primary care doctor. If you need help finding a primary care physician, let us know. We can do that. Just got to send us what your criteria is. Sometimes, this is the big one. Clients will say, I will not go downtown. Do not send me a doctor that's in downtown Boise. That's okay. Give us what the radius is. Hey, I'm willing to go to Meridian. I'm willing to go to Nampa. I want to go only 5 miles within my zip code. We can find those doctors in network for you that are accepting new patients. Or if you have a gender preference, sometimes ladies want to work with ladies and men want to work with men. That's totally fine. Let us know if there's any specifics and we can narrow that search down for you. Very happy to report that the specialist copay is going down by $5 from $40 to $35. That may not look a whole lot up front, but when you have clients that go in regularly for multiple follow-ups, it does add up. So at least it's a change in a positive direction. We're very happy to see some savings there. I want to remind you of what happens when you go into the hospital when you're formally admitted. This, I like to joke, works like an all-inclusive copay at an all-inclusive resort that you never want to stay at. So you're going to pay $325 a night for the first 4 nights that you're in the hospital. And that's going to cover everything that happens to you while you're there. Your room, your food, your surgery, your lab work, your imaging, your doctor consultations. It's an all-inclusive copay. If you're there 2 weeks, it doesn't matter. You're only paying for the first 4 days that you're staying there. So you're not even hitting half of your max out of pocket. I just want to point out, less than 3% of membership hits the max out of pocket. These copays are designed to be so low that it takes you a really long time to get there. Not saying that it's impossible, but it is not very likely, especially when you have just a few little things come up in the year. So one hospital stay will not make you hit your max out of pocket, which is really nice. Another key thing to know about inpatient hospital stay, I want to reiterate that it's an all-inclusive copay so that you can be aware of what you should see on a bill. If you were admitted in the hospital and you were receiving care, medications, medical treatment, you would have this all-inclusive copay. If you were being billed as outpatient, you would see an itemized bill. And sometimes we have clients that are being billed as outpatient observation when they were really inpatient and should have been coded and billed as inpatient admitted into the hospital. So I bring that up again so that you can cross-check your bills and make sure, oh, hey, this doesn't look right. I probably need to ask Shores Insurance or call into the insurance company and find out. Another key thing about inpatient hospital care, before you use a skilled nursing facility, that's when you don't need the hospital anymore, but you're not quite ready to go home yet, like an inpatient rehab, Medicare requires a 3 midnight stay in the hospital before they'll pay for a skilled nursing facility. So again, if you are being billed under outpatient observation and you've been receiving care, that's really not observation, is it? You should have been billed as inpatient. And it's not the doctor's fault. The doctor is responsible for providing the care. There's a third-party billing service that's being used. And sometimes, again, only you as the patient who received the care would be able to point out, oh, I think there's a discrepancy here. I need this to be reviewed and double-checked. Okay, so we had a client that was in the hospital for 5 days. 3 of those days were billed as observation when he should have been billed as inpatient. And it was a big deal because he went to a skilled nursing facility, and when he got out and all the bills kept coming in as denied, he hit the panic button. Oh my gosh, I'm gonna have to pay these bills. We were able to find, oh, nope, there was a problem with the coding. Let's call back into the billing company and get that addressed. It took us a little bit, but we finally got that reversed, and he was able to have those charges updated to the correct copay. Okay, any questions so far? All right, let's move along. Again, those who are joining us online, feel free to type in the chat feature there and we'll get your questions answered. Meal benefit. This is a really nice benefit that we want to make sure you're taking advantage of. This is available for post-discharge. So after you've been admitted into the hospital, you have to at least be in the hospital for 24 hours. They're going to give you this year 7 days, a week's worth of meals once for the year. Now it's going to be 2 weeks worth of meals as many times as you're admitted into the hospital. So if you have 3 hospital admissions, they're going to give you 2 weeks worth of meals every time to help you get back on your feet. The goal is to make sure they're supporting your recovery with good nutrition. The last thing they want is after you were in the hospital, oh, I don't feel good. I don't feel like cooking. I'm going to order up Domino's pizza. No, we want to get some good food in you to make sure that you're supporting your body in that effort to recover. So these meals are designed to be nutritious and delicious. They can follow any dietary needs that you or your doctor has. And again, it's just a quick phone call into customer service, or you can call our office. Customer service will verify in your claims history that you had an inpatient hospital stay, and they'll coordinate getting those meals sent to you and mailed to your home. They are frozen so that you can reheat them at any time at your leisure. Next update that we're happy to announce is the reduction in the ambulatory surgical center copay for outpatient surgical services. You're going to save $100 by going to an ambulatory surgical center. It used to be $325, now it's $225. So I want you to think of like Treasure Valley Hospital. They have no emergency room. They really just do those outpatient procedures, or a doctor's office that has an in-suite surgical unit like Hollingshead Eye Center for the people who are going there for cataracts. If you go to a surgical center versus going to the hospital, you are going to save $100. So that's a really nice benefit. You want to ask your doctor if they have privileges at a surgical center and which facilities they have privileges at, so we can verify that they are in network so you can get that low copay. Okay? Skilled nursing facility, I just described what you needed to know about inpatient, but let's actually go over the benefit. The rule of thumb, please try to get better in the first 20 days because you don't have to pay for the first 20 days. In the 10 years I've been doing this, most of my clients are able to get out within the first 20 days. Not saying that it's not possible to go beyond that, but most of our clients are able to get out. Where it really hits you is when you have a longer stay. So days 21 through 44, you're going to pay $196 per day. That is an all-inclusive copay, like the inpatient hospital stay that will cover all of your care while you're there. And then days 45 through 100 are going to be covered in full. Medicare only covers 100 days of skilled nursing, because if you're not better in 100 days, you don't need skilled nursing, you need long-term care. And they don't pay for that, sadly. So this is just for the temporary care, not a permanent long-term solution. But we did see a slight increase in the per day copay, but you're going to pay for fewer days. So sometimes we take a little bit over here to improve another area of coverage. We're doing something a little different this year. We have collectively taken all of the questions, the common trends, emails, service requests in our office, and we're trying to educate you on best practices. So who is responsible for verifying a doctor is in network? That's right, it's you. It is not the bubblegum chewer at the front desk who schedules appointments at the doctor's office. If you show your United HealthCare card, they're not verifying your specific plan. A lot of times they're just looking at the logo and going, oh yeah, we've taken United HealthCare. So you can easily verify this by calling our office, texting, email, live chat us on our website. You can call the carrier. I have up on the whiteboard the website link for United HealthCare, your member portal. If you haven't created a member portal, please do that. The website is www.medicare.uhc.com. There's a lot of resources on there right on your homepage. It's going to have find an in-network doctor specific to your plan. You can look up claims. You can look up your over-the-counter allowance balance. You can look up your gym membership. Everything that you need is going to be available in that member portal. So please take advantage of that. And if you need help setting that up, please give us a call. Levi is our tech guy. He's going to help you get that set up. Very happy to report a positive change on prescriptions. They're getting rid of the deductible. The deductible was applicable to name brand and specialty medications. It was waived for generics, and they've reduced the copay for generics from $10 to $8. We saw a slight bump in specialty drugs from 29% to 33%. They had to make that adjustment so they can lower copays and get rid of that deductible barrier. If you use mail order through United HealthCare, great option, because you're going to get tier 1 and tier 2 generic medications, 100-day supply for no charge. So you can eliminate that $8 copay by getting it through mail order, and it's a 100-day supply. So for my clients that are snowbirds or like to travel often, they like to have that stockpile saved up, because then they don't have to worry about a refill when they're out traveling. So please take advantage of that. Inside of your little goodie bags that you have there, I have a GoodRx coupon card for everybody. For anybody joining virtually, we can mail those to you as well. We'll include that in your renewal packet. That sometimes can give you additional savings. I highly recommend looking up on GoodRx website for the most recent prices. It will vary, and it can change frequently. It'll vary by the pharmacy and by the medication. If you want us to look up your drugs to find where the best savings is, sometimes it's using your United HealthCare card. Sometimes we have to look at other resources that are outside of insurance, and we have to get creative. Send us your drug list. Let us do that homework for you, and you guys can go into the next year confidently knowing, hey, I did all my homework. I made sure everything was covered, and I know exactly what I'm going to pay and where I'm going to get the most savings. All right, acupuncture. Acupuncture is a specialist, so we're seeing the same reduction from a $40 copay to a $35 copay. I like to point out on this that you need to make sure that not only are you seeing an in-network doctor, but also making sure they're contracted to provide acupuncture services. I'm going to give you a quick story. We have a client who saw his primary care physician who was able to offer acupuncture services. She was in network for primary care services, never contracted with United HealthCare to provide acupuncture. So all of those bills were denied, and he got stuck with a lot of them because he went like 10 times. So that's very expensive. We want to be proactive and find these things out before we rack up a bill that we can't undo, right? So just be very mindful of that. Additional routine foot care and podiatry services both move from 40 to 35. We like to highlight that for our clients who are diabetic or have medical conditions that they need to take extra care of their feet. The additional routine foot care does include removing warts, corns, calluses, and trimming toenails if you have really thick toenails or it's really hard to cut because you have a medical issue. No, Medicare does not pay for pedicures. We haven't convinced them to do that. So you have to go to a podiatrist to get these services done to have the foot care. You cannot go to a nail salon and then file for reimbursement. That's not going to be covered. So it has to be through a medical doctor, a podiatrist. Ambulance also reduced from $265 to $250, regardless of the method of transportation, whether it floats, flies, or drives, it's $250. So that's a nice little savings as well. It's the cheapest helicopter ride you'll ever take, I promise you. I hope you never do, because it means you're sick or hurt. Pop quiz time, best practice. We get this question quite a bit. How can I guarantee my claims are covered? If you call our office, we can tell you what the service copay should be according to your plan, but there is a formal process that your doctor can submit called a pre-authorization. That doctor submits the procedure codes they're going to perform before they perform them, and they should be including any chart notes or imaging records to back up why they want to perform this service. So you can't just say, I'm a doctor and I think so-and-so should have a surgery. Doesn't always work that way. You should have to, sometimes doctors have to explain why they should get this surgery done. Did we try medication? Did we try physical therapy? None of those things are working. So if you would like a guarantee, and I'm not talking about the little stuff like office visits and outpatient x-rays, I'm talking the big stuff, surgeries, major imaging like MRIs, CT scans, PET scans, the things that are thousands of dollars that you don't want to be stuck with that bill, ask for pre-authorization. The insurance company has to respond to you in writing with an approval or a denial. And if they're going to deny it, they will list why they're denying that service. So that's a very important part. We can only tell you what the benefits are under your plan. We cannot guarantee payment. That has to be done between your doctor and the insurance company. Hearing aids are getting better because they're very expensive. So hearing aids, they reduce the copays. There's several models to choose from. So their lowest model went from $375 to $175, and their highest end model went from $1,425 to $1,225. There's about 5 models that United HealthCare offers. They all have different tech advances. So some are going to be more advanced than others. It just depends what your needs are. You have to use United HealthCare hearing providers. You can't just go to any audiologist to get that particular benefit. So we're going to be getting a vendor list for 2023 with all the extras that are built into your plan. So it'll have the phone numbers and websites for the hearing aids, for your gym membership, for all the perks that you're going to see throughout the plan as a quick reference guide. So you want to call that phone number. They'll schedule you an appointment with an in-network audiologist that can provide these particular benefits, and you can get the savings. We've had people compare this to Costco, and it really is a savings. Not only are you getting a lower cost hearing aid, you're getting multiple adjustments, warranties, and extra batteries if you get a model with batteries. So definitely take advantage. Also happy to report another reduction. Imaging, diagnostic imaging, MRIs, CT scans were $165. They're going down to $150. So when you need an MRI prior to surgery, now $150 versus $165. Woohoo, savings. So we're just improving the benefits overall. Mammograms and colonoscopies that are diagnostic are still no charge. They do not want cost to be a barrier. Please go get your screenings done. Those are very aggressive forms of cancer. You will not have to worry about an out-of-pocket expense if you're looking for something. Okay, catch the small stuff before it becomes big stuff. Also, a big ask was, can we please reduce the outpatient rehab services for physical therapy, occupational therapy, speech therapy? That's going to go from $40 to $20. And that's going to be per visit. So when you get prescribed 3 to 4 times a week for several weeks, that's going to add up. That's very big savings. Looks like we have a question online. Levi, go ahead and read that out.
Yes, does UHC cover seeing an additional specialist in network to get a second opinion?
Yes, they do. You would just pay that specialist copay of, what did we say? That was $35. So absolutely, you can get a second opinion, no problem. But you just got to pay that consultation fee, that doctor office visit fee. Good question. Any other questions? Keep them coming, guys. I love the interaction. So great savings, again, overall. So when you, again, on the physical therapy, if you get prescribed 2 to 3 times a week for several weeks, they're cutting that copay in half. That's going to be huge. That may mean you can go a few more times without it burning a hole in your wallet. Super excited to also share with you the dental benefit has increased. It was $1,000 of dental coverage. It's going up to $1,500. They're giving everybody $500 extra dollars in dental. That's very helpful because if you have a crown, that'll blow through that. And a lot of people were left with nothing left over for cleaning. So I'm not saying this is going to meet all of your needs, because if you get 2 implants and a root canal, you're going to need more than $1,500. But it's a good start for no additional premium. We're getting an enhancement to the benefit. Yes, sir.
Is that, you get the 1,500, but you gotta spend 1,500 of your own first?
Nope,
They
it is,
split the bill, or they split the whole?
they pay the first 1,500.
That's different.
So that's a really nice benefit. You don't have to pay anything up front. They're going to pay the first 1,500. Now, fun fact, we are going to get the 2023 dental codes that we're going to be able to provide to you of all the services that are covered under this dental plan, because they now have added dentures and implants. No, it's not going to cover the full cost, but it'll help bring that bill down, that's for sure. And we will get that out to each of you, and you can show that list to your dental office. If a code is not listed on that sheet, it's not a covered service. So we're going to give you all of those details. Yes, ma'am.
For those of us that have baby boomers and would have this too, how does that work together?
So if you have a standalone dental plan already, like Delta Dental, Medicare is primary. This plan will pay first. And then whatever is after your allowance is exhausted, then your secondary plan will pick up the difference. So you will need to show 2 cards, and you tell your dental office Medicare is primary, and then your Delta Dental is secondary. So whatever they don't pay, if they're still charged, go ahead and bill Delta Dental. Okay?
What is Delta Dental?
Oh, that's just one of the insurance companies. It's just a plan that she had specifically. So that there's multiple carriers that can be offered. She just happened to be on a Delta Dental plan.
Does United Health offer a separate dental plan?
Well, yours already has built-in coverage. I would have to check if there's an optional dental benefit that could be added on top of this. Not sure off the top of my head, but I can look into that for you.
I have a separate dental, and I've heard that they have something that's better than what I have.
Well, let's look at it and compare. Absolutely. Let's, Heather, can you make a note of that, and we'll definitely address that. That's a good question. And again, if you have a lot of dental services that you're anticipating, we encourage that you actually get the treatment plan from the dental office with the procedure codes and their costs, and we can compare that to a dental plan and see if it makes sense to add a dental plan or if it's better off paying the cash price. We did have a lady not too long ago show us what her dental office was willing to charge cash, and we couldn't beat that. The premium almost ate up all of the savings. It was about a wash. So we just told her, hey, take the savings from the dental carrier and don't buy a standalone dental plan. And other times it makes sense to add extra coverage. So it really is a case-by-case basis depending on the services that you're getting. So if you can get us an outline, we can do that math puzzle, and we can actually show you an illustration of where your savings are going to be, if it makes sense. Because dental can be expensive. A lot of our plans start around like $45-ish a month per person. So we got to make sure that that extra premium is worthwhile. Okay.
Do you still sell baby boomers?
Baby boomers is actually gone away. So we've been working with the carriers directly. We just had dwindling membership, so we weren't able to keep that going. Yeah. Also want to point out that you can go see any dentist, but you will save more when you stay in network. I want to give you an example. So let's say you see a doctor that is out of network because you absolutely love them and their services, and they've been good to you throughout the years, but they're not, again, an in-network physician. That's fine. You will still have coverage, but let's say United HealthCare only pays $100 towards cleanings, and Dr. Smith that you want to go to charges $150. Well, United HealthCare will pay the $100, but there's no contract that says that Dr. Smith has to accept that as payment in full, so he can still bill you for that remaining $50. You still get the $100 benefit, but if there's extra services, that's called balance billing. So you're better off in network, but you have that flexibility and that power to see any dentist that you want. Your $1,500 just may not go as far. Keep that in mind. Question?
I think you may have skipped the hearing aid slide by accident.
Don't think so. We just talked about the hearing aid slide.
Okay.
Yeah. Oh, we're good. Yep. Thanks for keeping me honest, though. Appreciate that. Making sure you're all paying attention. All right, pop quiz time. Every year when we send out those postcards, people go, well, how do I know I'm on the best plan? You got all these plans on here. I'll help you out. I made a list. Are your doctors covered? Probably not a good plan if your doctors aren't included in the network. So let's just get the basics out of the way. Let's verify your medications because each company has different formularies. Some companies are going to have more favorable copays or more favorable tiering for medications than others. So let's compare your drug list. Send those details to our office. Again, you can call, text, or email those. What services are you going to utilize the most? That's going to really help us because if I put all the plans side by side, you're going to find something from every plan that you like more because there's a lower copay over here. There's a lower copay over here. It's not a true line item per line item comparison. So let's prioritize what you think you're going to use the most so we can identify which benefits are going to be the most important to you. Of course, we want the plan that has 0, 0, 0, 0 everywhere, but they don't exist. And there's no one size fits all. Your needs are different than your needs and are different than her needs. So we have to really keep in mind that it is truly an individual basis. Are you using all of your benefits? Every year I meet with clients, I hear, I forgot I have over-the-counter benefits. I haven't used any of that. You're leaving money on the table. Don't do that. So that's why we're refreshing you with some of these benefits. Are you using all of the dental? Are you using all of the vision? We get little tidbits where people are overspending and they're like, oh, well, maybe this plan's not that great. No, we got to get you re-educated on all the benefits and make sure you're taking advantage of all those perks. Yes, sir.
Did I hear you right? You just said there's over-the-counter benefits?
Oh, there is over-the-counter benefits. I believe it's my next slide. So stay tuned. I'm going to blow your mind right now. Oh, man. Oh, yeah. Just you wait. You might be kicking yourself after this.
Oh, I already do.
You're like, dang it, that was me.
$50
She's-
every 3 months.
That's the one. That's the one, but it's getting better
How
next year.
come my friend down the street gets $85 a month and I only get 50? She's got United HealthCare also.
Different plan. She could be on a plan that's just a different network. So sometimes you give up a benefit. So for example, the St. Luke's version of this plan that's a 0 premium plan is an $80 per quarter benefit. But guess what? You don't get to use St. Al's doctors. So you're giving up St. Al's, but they're giving you a bigger benefit.
She doesn't pay any premium when I do.
Yeah. So she's
She
probably,
gets $80 and I get 50.
she's on the St. Luke's plan.
Doesn't live here.
Oh, gotcha. Yeah. So, and it could vary by state too, by the way. Every state has their own. So even though United HealthCare is a national carrier, the benefits in Idaho could look different than Florida, than New York, than wherever. So it really is state specific and county specific. County. So if you look on your summary of benefits, it actually tells you what counties that plan's available in. It's not available throughout the entire state of Idaho. So if you were to move out of the county, you may not have this plan available to you depending on where you're moving to.
Why is that? I often wondered why it's like that.
Just contracts, administration costs. The more rural the area that you go to, you may not get as good of benefits. You may have to pay more because it costs the insurance companies a lot to administer in that area. They have a small population and not a lot of doctors. It's very expensive to try and support that community. Versus Ada County, which is the biggest county in the entire state. So pretty big difference. Oh, and the last one, do you feel any cost burdens? Let me give you a quick example. We have a client who was going through radiation treatment, very expensive. We needed to change the plan because he was like, hey, I can't afford to keep up with 20% on my plan. You got anything better? Absolutely. We found him a plan that was $65 each time he went. Very happy. So vocalize where your biggest expenses are so we can address those. A lot of times we may be able to find a solution. Sometimes we have to get creative and think outside of the box of insurance, especially when we're talking about prescription drugs. But please let us know where your biggest expenses are because we can help. That will help us with our strategy and which plans we're looking at. Here you go for you, my friend, over the counter. So instead of $50, it's going up to $60 a quarter. But here's the best part. This year, you guys had to order online, over the phone, or by mail. You are now going to get what's called a U card. It is a new beefed up version of your ID card, just like the one you have in your wallet right now. You'll still use it when you go to the doctor, the hospital, the pharmacy. But now when you go to a Walgreens or a CVS, we're going to get you a list of all the retail locations you can go. You can use it like a debit card to buy your over-the-counter items. In the store, it will have on the price tag OTC approved, so you know what items qualify.
I like to sit on my computer in my chair. I don't want to have.
No, you don't have to sit on the computer anymore. You can go in person. Oh, you do?
I don't want to go to the store.
Oh, well, you still can do that too. But they're giving you the power if you see something and you're out and about already in Walgreens picking up your prescription or whatever it may be, and you're like, oh yeah, I needed vitamins. Let me just grab that real quick. You can pay for it right there. Yes. Yeah. No, it's the same ID card.
Oh.
It's all in one card now.
Oh.
He can call the store and they'll bring it out to the parking lot or bring it to your door.
Oh, there you go. There you go. So there's something for everybody. They're just giving you more flexibility, more options, which is really nice. And you don't have to wait for it to be mailed to you if you need something immediately. So remember, the over-the-counter items are going to be your vitamins and supplements, your cold cough allergy remedies, especially as we enter flu season. Nice to stock up on some of that stuff. Your first aid supplies, your oral health hygiene, like your toothbrushes and toothpaste. So don't pay for toothbrushes. You're leaving money on the table if you don't use that. And remember, it is a use it or lose it. So if you don't use that full $60 in the first quarter, that unused balance does not carry over into the second quarter. Online in your member portal, www.medicare.uhc.com, it'll have your balance in case you forget. Yes.
Will they automatically send those cards every quarter?
So it's one card, they're automatically going to reload it. You will not keep getting a new one. They just reload it on the back end. How cool is that? So nice. So one card that will do it all and have all your benefits built into it. Finally, they got smart. Woohoo!
But the only products it covers, it has to say UTC on it.
OTC
OTC.
for over the counter. Yeah. So
Okay.
when you're in store, you got to read the label.
Okay.
Yep. Sadly, it won't work when you try to sneak in a candy bar on the conveyor belt. So it'll only work on the OTC approved items.
No beer and stuff like that.
Sadly, no beer, no wine, even though it may drive you to drink. Nurse Line, I want to make sure you guys are taking advantage of this benefit as well. So I like to use a personal story to help make it a little bit more relatable. It's an underutilized benefit that you guys have at the touch of your fingertips. Now, Ruthie, you may not need it because you have the experience and the knowledge. She worked in the medical field as a nurse, so she already is her own nurse. But I got bit by a spider, and I was worried it was that brown recluse thing that you know, can make your whole hand fall off. It was a pretty ugly bite. So I thought to myself, gosh, okay, I don't know if this is the big scary one. I really don't want to spend all day in the emergency room and pay a fortune for them to tell me it's no big deal. But I also don't want to be the dum-dum that neglects my care. I'm going to call the nurse line. So I call the nurse line, talk to her, and she's like, okay, do you have any of these symptoms? And she goes down the list. I'm like, no, everything's good. She goes, okay, well, take a Sharpie, draw a circle around it, write the time so you can kind of track the swelling. She told me to get some baking soda and water, make a paste, put it on there to help extract the venom out. And she said, okay, if you develop any of these scary symptoms, you should go in. And that's really all you could do. Put some ice on it, chill, relax, get out of your own head, stop overthinking it. You're not going to turn into Spider Woman. I'm like, all right, no problem. So I felt really good that I got the care that I needed without having to waste time or money. And again, I was supported. So there are registered nurses and it's 24/7. So if it's a phone call at 3 o'clock in the morning, that's fine. You can call at 3 o'clock in the morning. They can answer questions about medications if you're worried about side effects. They can call ahead to the hospital to let them know that you're coming. They can give you over-the-counter remedies to help with any ailments that you have. So take advantage of that. On the vendor list that we're going to be getting to you, it hasn't generated yet, so we're still waiting for it to post. A lot of these things won't post until October 15th when annual enrollment actually starts. We will get that to you so you can post that right on your fridge and you have the number to call at any time. Another underutilized benefit, personal emergency response system. So most people will equate that to Life Alert, you know, like those commercials that you see, help, I've fallen and I can't get up. It's a little bit more creative than that. Our clients are getting very, very creative with how to utilize it. So the device itself is no charge, and it's supposed to be a pretty easy, lightweight device that can even tuck into your pocket, or you can wear it around your neck if you would rather. But the monthly monitoring service and the device are included at no charge to you. You do not need a landline to set it up, which is awesome. Couple creative ways our clients are using it. We have one client who is a mountain bike rider, likes to go to areas where there's hardly any cell service, freaks his wife out. So they have this deal. If he's not home by a certain time, she's going to call in the cavalry. So now he takes this device with him. It's got the fall detection, GPS monitoring. So who cares about the cell phone towers? They can find you wherever you are. Two-way communication, and it's waterproof. So if he falls and they call to him and he does not respond, they're going to send in first responders, and they're going to notify his wife, who's his emergency contact. So they both get to sleep well at night knowing, hey, he can live his active lifestyle and there's a backup in case there's an emergency. Another client, she lives by herself. She saw a peeping Tom in the window, freaks out. She's like, okay, I'm not going to call 911. I don't want to overreact. So she presses the button and just says, hey, can you stay on the line with me? But if I scream, call everybody. So she was fine, but ultimately it was just nice to have a comforting voice and somebody there that can press the panic button if she needed, the police there. And then the last story is we had somebody that got lost, a little confused about which direction they were going and needed help getting turned around. So they just clicked the button and got navigated home safely. So you can use it however you want. We did have one client after a surgery, even though family and friends were at home to help with the recovery, they were out running errands. Well, she went to get out of bed and she had lost the feeling in her legs, some numbness there. And when she went to take a step down, lost her footing, hit her head on the side of the nightstand, and was unconscious until that person came home. So it would have been nice to have that device with the fall detection available because, again, if you're not responsive, they will send somebody to check on you.
Just one particular company you're talking about? I see those things advertised everywhere.
Yeah.
Does it not matter where you get it?
There is on the vendor list. You have to call that specific number. I'm blanking on who the vendor is at the moment, but we will get that information to you. It's right on that vendor list. We're still waiting for them to print those. We don't know if they changed the vendor from 2022. I have the 2022 vendor list. I just don't have the 2023 one yet. Yeah, but as soon as we get it, I promise we will send that to you and to anybody who's attending virtually. Vision, another enhancement. They're going to give you $250 allowance towards frames and contacts. That's an upgrade from this year. It was $200 this year. So there's no charge for the lens portion of your glasses. They'll pay for the prescription portion. If you need enhancements like anti-glare, anti-scratch guard, transitional lenses when they turn into sunglasses when you walk outside, those sadly are not covered. You'd have to pay out of pocket for those. But again, they're helping with the hardware and the prescription portion of the lens. A lot of people will still buy a standalone vision plan to help cover the cost of the enhancements because they could be expensive. So just like I said with the dental, get that itemized sheet from the optometrist's office with what the charges are before they order the glasses, and we can see if it makes sense to add a vision plan. Vision's pretty inexpensive and can be added anytime throughout the year, or you may find that this works just fine for you. But you have to use, you want to make sure you're staying in network for that one to, again, maximize your savings.
That doesn't cover getting your eyes tested, does it?
It does, actually. Your eye exam is a zero copay under that plan. I just didn't have it up there because it didn't change from last year. I'm sorry. Should have put that on there. But it's zero for the eye exam. Yes.
So does that plan, in addition to our extra plan like vision service?
Mm-hmm.
So we use it first and then vision service?
Yep.
Okay.
Especially if you're trying to get a second pair or sunglasses, it might not be a bad idea to say, hey, I have two. I need you to work out the strategy as to which one is how to maximize my benefits. Not every optometrist office is great at doing that, so call us and we can help you with that. All right, bodies in motion tend to stay in motion. So you got a fitness benefit built into your plan at no charge. The U card gets rid of you having to print off that code and hand it to the gym. Everything you need is on the U card. So it's your ID card, but beefed up. It's got all your benefits on there. So you don't have to go different places to pull things down. Nope. You can go to as many gyms as you want. If you want to go to the YMCA for the aquatics class, you want to go to Axiom for their Zumba class, you want to try another gym for whatever perk they've got, you can go to as many gyms as you want. They do have to be part of the Renew Active network, but again, all the major gyms are included: Crunch Fitness, Anytime Fitness, Planet Fitness, all kinds of, sadly not the Nampa Rec Center, but there's still tons of options. They've got private cycling studios, yoga studios, bar studios, the dance bars, not the bars. So don't get too excited about that. But anyway, it is a great benefit. Please make sure you are utilizing that. It's no extra charge. They do have online classes and online brain exercises through Member Portal. Member Portal. We love our Member Portal. I'm going to keep saying it. Member Portal. Use your Member Portal. Don't forget, you also have routine transportation to help you get to and from your doctor's appointments. You get 12 one-way trips or 6 round-trip visits. You have to schedule it 72 hours in advance. That vendor sheet we're going to give you is going to have the phone number so you can call. They will help you, again, get to and from your doctor's appointments. So if you want to save on gas, since gas is really expensive, that's a great way. Or again, if you are using a service that is going to give you the good drugs, like a dental service, and you shouldn't drive afterwards, or they're going to dilate your eyes, this is a great option. So you don't just have to rely on family and friends. You have this as a backup. And again, must schedule in advance. It's not like Uber on demand, sadly. Pop quiz time. Everybody received in front of them their summary of benefits. We want you to read your summary of benefits prior to going to get the service so you know what it's going to cost before you go. And again, that also helps you interpret the bill. Oh, wait a minute, this is not right. My summary says I should only pay $200. They're charging me $300. There is a problem. So that needs to be kept in an easy to find location that you can just grab and reference at any time. Make sure you're reading those summaries, and call us if you have questions. Before you pay your bill, read your explanation of benefits from the insurance company. That is going to go over, hey, this doctor billed us for this service. Make sure you actually had that service done, because sometimes we've seen people billed for things they didn't actually have done. It tells you how much the insurance paid and what your portion is after insurance has been applied. Your patient responsibility on the explanation of benefits should match the amount due on the bill. A lot of times, hospitals and doctors are sending you the bill before they even bill the insurance company. What's very misleading is on that bill, it'll say insurance adjustment. So you read that and you go, oh, they applied the insurance. No, that is their guesstimation of what they think the insurance is going to pay. So we have a lot of clients that are paying more than they should, and then they have to fight for a refund. They're quick to take your money, not so quick to give it back. It can be very confusing to read an explanation of benefits. If you need help, please call us. Another thing, in your member portal, it is very possible that you can see multiple claims for the same date of service from the same doctor. You'll see deny, pending. That usually is an indicator that the wrong codes were used. There's missing information like chart notes or imaging records, and the insurance company is going back and forth with the billing party saying, hey, we need you to rebill. Something's not right. You do not have to pay that bill until the claim has gone through. If the hospital or doctor is clawing at you saying, hey, we're going to send you to collections if you don't pay, I have insurance that is supposed to pay first. When you do your job and you bill it correctly, then I will pay the bill. That's not how insurance works. It's not a refund policy, right? So there's an obligation that they have to do their part before they can threaten to send you to collection. So don't let them strong arm you. If anybody gives you guff about it, you call me. I got a pair of pink boxing gloves I keep in the closet. I'll beat them up for you. So those are really important things, again, to be proactive so that you have a smooth claims experience. I want to also go back for just a quick second before I open it up to questions about dental. The best way you guys can have a smooth dental claim is to request a predetermination That's the magic word, predetermination, for any services outside of a cleaning. And I'll tell you why. We saw a lot of denied dental claims this year with United HealthCare, and it wasn't the client's fault. United HealthCare required a certain percentage of tooth decay before they would pay for the replacement of that tooth. How do you know what your percentage of, who knows what their percentage of tooth decay is? I don't. Only your dentist is going to know that. So there's limitations within the plan. So before you rack up a bill that can't be undone, hey, dentist, why don't you go ahead and run a predetermination? Let's make sure my insurance is going to pay on this before we rack up that bill and you try to bill me for what they're not covering. Again, it's all about a proactive approach versus a reactive approach. How do we enhance and improve your experience so that you're not frustrated and having to fight claims all the time? And we just know this because we're seeing it and we're on the other end of the phone. We're taking those calls and we're trying to find the best practices to make sure that you guys are maximizing your benefits and you know the best tips and tricks to avoid those heartaches and pains, okay? With that being said, do we have any questions? Yes, sir.
It's good to ask for prior approval. What's going to come. What if you're going to surgery? You don't know about the radiologist, in network, out of network. He's going to charge the person that puts a Band-Aid on it. You know, all these extra things. You don't know. So what are you supposed to do?
Well, that's a great question. We get that a lot, especially with like anesthesiologists, right?
Yeah.
So technically, it's not just because you use St. Luke's that you should assume that that anesthesiologist is contracted with St. Luke's. They could be an independent that they hired in. That's, again, where the pre-authorization is going to come in. You got to talk to the doctor's office and say, hey, I also need to know who is going to be the anesthesiologist. Most of the time, those are included as in-network. The carriers have gotten really good about understanding what it is like from your perspective. Every once in a while, we'll get something where, yes, somebody comes in as out of network, and you're like, how would I have known that? And we're able to fight that. There's appeals and grievances that can be filed. And if you were not given the proper information to be able to find that in advance, then we can fight that for you. But I would just make sure you ask, especially when it's an elective procedure, right? Like a knee replacement, that's something that you can coordinate in advance versus like a heart attack. When it's an emergency, don't worry about any questions. It's always in network. But when it's an elective procedure, you want to ask those questions to the doctor, the surgeon, and say, hey, I need the pre-authorization, not just for you, but I also need it for any other physicians that you guys are going to be using. It's technically the doctor's responsibility to be filing those on your behalf. It's not your responsibility as the patient. So just ask the question. I know they don't volunteer that information, so that's why we're trying to educate our clients to empower them to take charge and be their own personal advocate. We're still here to help you and support you, but you got to get us some of that information too, right? Because HIPAA, they won't just share that with us. But good question. Anybody online have any questions? We're good there. Oh, yes.
On the occupational therapy,
Yes.
is that a kind of the wrong title for that? Now, if you go to the hospital and have knee surgery, you're going to have physical therapy afterwards. That would be the same thing, wouldn't it?
Right. Well, occupational therapy is really going to be more for like learning, if you're trying to learn how to write again, or feed yourself again, like very specific things, whereas physical therapy is like rebuilding, as you mentioned, the knee muscle and making sure you can walk and do all that. And then you have speech therapy that's specific. So there's all these different buckets for different specialties. So it's just broken out. And in this case, what's nice is it's all grouped into the same copay. They just list them out separately because there's different specialists and different providers that you can search by. I'm looking for a physical therapist. I need an occupational therapist. Hey, making sure I'm paying attention. So that's why they have it listed and broken out separately. So that way, when you're searching in-network providers, you can look for that specialty, but the copay is the same regardless. Perfect. Yes.
So I use Costco for my eye exams
Mhm.
and glasses. That when I get the glasses, they know what United HealthCare pays for, and so I don't have to pay hardly anything. But the eye doctor does not. Is there a way I can like file a claim or something?
Yeah, there is a reimbursement process. If that doctor's out of network, like I said, you may not get as much back, but there is an actual reimbursement claim form that we can send to you. The optometrist still needs to fill that out and sign as the provider that gave those services. They don't just let you fill those out. And then it gets mailed to the insurance company. They'll review that. They'll see, oh, okay, this is how much you paid. How much should we reimburse based off your benefit? And you'll get a check in the mail. So there's an actual form for that we can send you. Or member portal, that's got it on there too. You can do an online claim that way, or download it from there as well. But again, usually the doctor has to sign for that to authorize that they provided those services. Yeah, good questions. All right, guys, let me remind you of a few important dates. Annual enrollment period officially starts October 15th, runs through December 7th. This is the time to make plan changes if you have any need. If you're generally happy with the plan and it's working well, we're still going to encourage you send your doctors and prescriptions for us to verify. But other than that, if you're happy, we love the enhancements they're making. We would say if it's working for you this year, it should work for you next year since they've made a lot of improvements. If you want a one-on-one appointment, we've got set times over here on the table. If you're online joining us, just enter in the chat that you would like a one-on-one, or if you'd like to renew. Heather in the back, if you want to renew, we'll send you your renewal packet. If you want to just let her know, you will automatically be renewed if you take no action, but we would like to just collect that feedback so we know you've been touched. We verified your address so we can send those details to you and all the upcoming materials that we're waiting to be available from the insurance company. So again, if you leave today and you're like, yes, I want to renew, and then your neighbor tells you about some fancy dancy plan and you want to come learn about it, no problem. You can call our office and schedule an appointment anytime between October 15th and December 7th. The last enrollment that you submit on December 7th is the one that takes effect January 1st. And please remember, Medicare does not make outbound phone calls. Be very careful. And if you have questions about what you're seeing on the commercials, please verify that with us. Don't just assume that JJ Walker and Captain Kirk are telling it how it is in Idaho. But thank you guys for attending. I really appreciate your time. I hope you found that this was informative. Remember, our office is here to fully support you with anything that comes up. And we just want to make sure you guys are empowered and can go into 2023 with confidence that your needs are going to be met. So thankfully, we got a better plan for you next year. And I hope that everybody does well. Thank you again for joining. You guys have a great rest of your day. I'll come answer your question. Yes.